So, welcome to this session on Cubital Fossa, which is situated in front of the elbow, front of the elbow. Okay. So, if I see the front of my elbow here, I can put my finger, I can dip my finger in this area, and that is the cubital fossa. That is the cubital fossa. It's a triangular halo situated in front of the elbow. We have a similar fossa in the lower limb at the back of our knee, and that is the popliteal fossa. Okay. Now let us check what are the boundaries of cubital. Now, to know the boundaries of cubital fossa, now suppose this is the lower end of the humerus, where I need to define that this is the medial side, this is the lateral side, this is superior, and this is inferior side. So humerus at its lower end, in the two corners shows two epicondyles. Okay, the medial epicondyle and the lateral epicondyle. And here there is the trochlear notch for ulna, and this is the capitulum for radius. Now, coming from the medial epicondyle is a muscle called as, the name of that muscle is pronator teres. The name of the muscle is pronator teres. And here there is another muscle. Which is coming from the lateral aspect of the humerus. And that muscle, of course, it will go down, and its name is brachioradialis. Brachioradialis. So this is brachioradialis, this is pronator teres. So these are the boundaries. Now, when we say the boundaries of a fossa, we have to define it clear, that what lies laterally. So laterally is brachioradialis. But now this brachioradialis also has two boundaries. See, this is medial side, this is lateral side, this is superior, this is it. Apex is there, inferior. So this is the medial border of brachioradialis, this is the lateral border of brachioradialis. This is because this is medial side, this is medial border of pronator teres, this is lateral border of pronator. So laterally is medial border of brachioradialis. This is anatomical language. Laterally is medial border of brachioradialis muscle. Medially is lateral border of pronator teres. Pronator teres, this is medial border, this is lateral. So medially is lateral border of pronator teres muscle. Lateral border of pronator. Base is formed by an imaginary line passing in front of two epicondyles. So this imaginary line passing through the two epicondyles, it forms the base. This imaginary line forms the base. Okay. And now let us discuss what forms the floor and the apex. Sorry, base, lateral border, medial border, and apex. Apex is meeting point between the lateral and medial border. Apex is the meeting point between lateral and medial borders. Meeting point between lateral and medial. That forms the apex. Base is formed by imaginary line. Medial is lateral border of pronator teres. Lateral is medial border of brachioradialis. Now there are two muscles which form the floor. There are two muscles which form the floor. One is the muscle brachialis, which is going to get inserted on the medial side on the ulna. So this brachialis muscle and another muscle. Now this name you are hearing for the same first time. Supinator muscle. Supinator muscle, which is wounding around the upper part of the radius. So this side is radius, this side is ulna. So supinator muscle. So these muscles are forming the floor. So floor is formed medially by brachialis muscle and laterally by supinator muscle. Okay. Now what forms the roof? What forms the roof? Roof of most of it is formed by skin. Most of the triangles, fossae, when we talk about the roof, we say the roof is formed by skin. Then we talk about superficial fascia. Normally, lukewarm students say, right, superficial fascia, deep fascia. But there are some structures in the superficial fascia, and that is the median cubital vein. Median cubital vein. When we look at the cubital fossa, there are two veins passing in the arm. Cephalic vein is there here, and the basilic vein is here, and connecting them is median cubital vein. What is the significance of this median cubital vein? Now this is the lateral side and this is the medial side. This median cubital vein, it is the one from where the blood is withdrawn from blood collection. In your life, some point of the other, you must have, your blood must be removed for some investigation. So that in the cubital fossa, that means in the cubital fossa, we do auscultation for blood pressure. The blood removal for is withdrawn for blood collection from median cubital vein, which is in the floor. Also lower down is the bicipital aponeurosis. Bicep gets inserted on the radial tuberosity and hence a bicipital aponeurosis. Okay, we also see the medial cutaneous nerve of arm. Okay, so median cutaneous nerve of forearm in this field. Okay. So, and the lateral cutaneous nerve of forearm, which is given by the musculocutaneous nerve. So, medial cutaneous nerve of forearm, sorry, and lateral cutaneous nerve of forearm. So many structures in the. So normally, what students write? Skin, superficial fascia, deep fascia. So then we give them only half mark. They never get a distinction. So for distinction, what you will have to write? Median cubital vein, bicipital aponeurosis, medial cutaneous nerve of forearm, lateral cutaneous nerve of forearm. Then we realize, oh, they know medial cutaneous nerve of forearm, lateral cutaneous nerve of forearm, medial cubital vein, bicipital aponeurosis. Four things. Then deep fascia. So these are the structures forming the roof. We have seen structures forming the floor, brachialis and supinator. We have seen the structures forming the boundaries. The pronator teres, brachioradialis, imaginary line, apex, roof, floor. Now coming to contents. Contents, contents are four. Contents are four lying from medial to lateral side. Contents. Now what are there? The contents. The contents are one, the medial most content. Median. Then two, brachial artery. Three, tendon of biceps. Tendon of biceps. Brachii. And lateral most is radial nerve. So structures lying in the cubital fossa from medial to lateral side are medial nerve, brachial artery, tendon of biceps, and radial nerve. Rather, what we do, we tell the students that here you feel the tendon of bicep. We can actually very nicely feel. and then medial to the tendon of biceps, press for the getting the brachial artery pulsation. Okay, so medial nerve, brachial artery, tendon of biceps, and radial nerve. These are the contexts. The median nerve then leaves passing between the two heads of pronator disc. Brachial artery in this region divides into ulnar artery and radial artery. Okay, it also gives the, of course, the ulnar artery also gives the anterior interosseous artery. Then there is biceps brachii tendon. There is biceps brachii tendon. Okay, and radial nerve just comes at the corner. Radial nerve comes at the corner. What is the significance of this fossa? Clinical anatomy of this fossa, that it is median cubital vein is used for blood collection. It is used for blood collection. It is used for giving IV to the patient. Okay, and blood pressure is measured in the cubital fossa. Blood pressure is measured in the cubital fossa from the brachial artery. And we should be also this knowledge of cubital fossa is useful when we have a when the patient has a supracondylar fracture of. So with that, we complete the topic on cubital fossa.